So we're going to start with the language of anatomy. And first and foremost, why do we need the language of anatomy? Why do we need this special terminology? Why can't I just say arm or ankle or wrist? Because we need standards. We need exact terms so we know exactly what we mean when we're talking about certain positions or directions or regions or even structures. Such as the standard anatomical body position. No matter if someone's curled up on their side or standing up in this position, we'll know exactly what we're talking about when we say, for example, femoral or cephalic or brachial. The standard anatomical body position is for comparison, just to figure out where something's located. But if you're sitting down right now, you're not in standard anatomical body position because it involves someone standing up with their body erect, their feet slightly apart and facing forward, their palms facing forward with their thumbs pointing away from the body or laterally. Also keep in mind that when you're using terms left and right, it's the patient's left or right, not your left or right. That's going to be reverse from your left or right. We want to look next at regional terms and planes. Now, regional terms are going to designate specific areas within two general body divisions. And we'll look more at these body divisions later. But the axial and appendicular body divisions are two broad topics. The axial division includes the head, neck, and trunk. The appendicular includes your legs and arms, essentially your appendages or your limbs. The appendicular division is attached to the axial division. To make sure you're not kind of messing this up, just think axial, axis, or kind of middle of the body, appendicular, appendages, therefore your legs and arms. There's also three planes that you want to discuss, the sagittal, frontal, and transverse plane. The sagittal, also called the median plane, is going to separate the human body into a left and right side. The frontal, also called the coronal plane, is going to separate the human body into a front and back side. And the transverse, or horizontal plane, is going to separate the human body into a top and bottom side. And you can take sections or use these planes to take sections of the human body in different locations. It doesn't have to be right down the middle for the median plane. The example being shown, number A, that is actually a mid-sagittal section because it is right down the middle, and it's separating the human body into an equal left and right side. But you could have a parasagittal plane, meaning that it's not right down the middle, maybe it's a little to the left or the right, but it's still separating the human body into a left and right side. So our body planes again, our options are sagittal, frontal, or transverse. Frontal is also called coronal. Transverse is also called horizontal. And body planes are useful in order to talk about cuts or sections made along a body plane, either in surgery, or we could even use them to talk about specimens that are being used on a microscope. Cuts or sections are named after the plane. So, for example, a sagittal cut has basically been a result of a sagittal section. But body planes are just surfaces along which body or structures may be cut for anatomical study. And if you missed what I said previously, 2 slides ago, we do have all that information here. You see a sagittal section divides the body into left and right. A frontal section divides the body into front and back. That's anterior is front, posterior is back. Then a transverse or cross section, that's actually another term for transverse, cross section. So you have horizontal and cross section there. Divides the body or even an organ, which is superior, which is top, and inferior, which is bottom parts. And then here are those two terms I mentioned, mid-sagittal and parasagittal plane. Their definitions are if a cut was made perfectly on the midline of the body, separating the body into an equal left and right side, that would be a mid-sagittal or median plane. Whereas a parasagittal plane would be a cut that's off-center, it's not on the midline, but it's still separating the human body into a left and right side, just not equal. And then one we haven't mentioned yet is an oblique section, which is the result of cuts at an angle, so it's a diagonal section. So let's try some questions. How about you are a surgeon and planning to do open heart surgery? You would need to make a blank cut into the chest cavity. All right, if you said sagittal, you would be correct. How about you have a patient that has gangrene in the lower portion of their leg and you need to amputate? You would make a blank cut through the leg. If you said transverse or horizontal, you would be correct. The abdominal muscles and muscles of the back are separated by the blank plane. If you said frontal or coronal, you would be correct. Next, we're going to look at regional terms, and they're used to designate specific body areas. And I'm going to go ahead and tell you need to be really familiar with these. So we're going to start on the left and work our way to the right. So first and foremost, you have the cephalic region. That's anything on the head, including the forehead, which is frontal, the eyes, which is orbital, the nose, which is nasal, the mouth, which is oral, the chin, which is mental, and then we move on to cervical. Cervical is talking about the neck, both the front and the back. Then if we move down to the orange region, that's the thoracic cavity or thoracic region. We also have a pointer pointing to your breastbone, and it's saying sternal. That area is the sternal region because the bone below that is the sternum. Then pointing to your armpit, so you actually have two auxiliary regions. That would be auxiliary armpits. And then your mammary regions are where a female breast would be or male pectorals. Now moving to the upper or superior purple region. That's the abdominal region. The inferior purple region is the pelvic region. Your belly button is within the abdominal region. That's called the umbilical region. The inguinal area is below the pelvic region. That's your groin. And then the pubic region is your genitals. Now let's move to the middle. We're going to start with your upper limb and then move to the hand, lower limb, and then the foot. Now, the upper limb includes your shoulder, which is the acromial region. It includes the brachial region, which is colloquially called the arm. And so the arm, if you use that in anatomy and physiology, actually only talks about the area between the elbow and the shoulder. Your entire upper limb is not the arm. The inside fold of your elbow is the antecubital region. Your elbow is the olecranal region. The area between your elbow and your wrist is the antebrachial region, also colloquially called the forearm. Your wrist is the carpal region. Another name for your hand is the manus region. It includes your thumb, called the pollex, your palmar region, which is your palm, the back of your hand, called the metacarpal region, because it's located over the metacarpals, and your fingers and toes are both called digital regions or digits. Next, let's move to your lower limb. You have the hip, also called the coxal region. You have the thigh, also called the femoral region. You have the patellar region, which is your kneecap. You have behind your kneecap, so the bend of your lower limb, the popliteal region. Your crural region, also known colloquially as the leg, is something you might call your shin, whereas your calf is the sural region. So crural before sural, so shin before calf. So C before S alphabetically. You also have on the side the fibular or peroneal region. That's actually where your fibula, a bone, would be located. Then another word for your foot is pedal. Your ankle is tarsal region. Your heel on your foot is the calcaneal region. The top of your foot is the metatarsal region. Your toes are digits or the digital region. The bottom of your foot is the plantar region. And your big toe down there is the hallux. And now we move over all the way to the right. We've looked at the cephalic region, that's anything on your head, but we didn't mention the otic region, which is your ear, and the back of your head, which is the occipital region. Then cervical again, because that's front and back of your neck. In blue, we have the dorsal region, which includes that chicken wing portion of your back called the scapular region, your vertebrae or vertebral region, and then the lower part of your vertebral region, just outside that, is the lumbar region. Then below that is the sacral region. Then your butt is the gluteal region. Then between the anus and the external genitalia is the perineal region. So again, this is going to take just straight memorization. Just spend some time with it, work through it, practice testing this on yourself, practice labeling others in your household. Just really work with this material so it's almost commonplace or very familiar with you. Other things we want to talk about are directional terms. And directional terms are only used when we're comparing one body structure to another. If you're just looking at one body structure, you wouldn't use a directional term. Because if I said your head is superior, to what? These are comparison terms. So we would only use these terms again in order to allow body parts to be located precisely. And if we know where two body parts are and we can compare where one is compared to another, then these are really helpful. So our directional terms are superior, inferior, anterior, posterior, medial, lateral, proximal, distal, superficial, and deep. I'm going to give you a quick definition for them, and then we'll look at them in more detail. Superior means above the other structure, or towards the head compared to the other structure. Inferior means below the other structure, or towards the feet compared to the other structure. Anterior means towards the front compared to the other structure. Posterior means towards the back compared to the other structure. Medial means towards the middle more compared to the other structure. Lateral means towards the outside or away from the middle compared to the other structure. Proximal and distal are special, so I'll come back to them in just a second. Superficial means closer to the outside of the body compared to another structure. And deep means deeper inside the body compared to the other structure. Now, proximal and distal are special because you can only use them if both of the structures you're comparing are on a limb. For example, if I'm talking about my elbow and my wrist, I can use proximal and distal. If I'm talking about my belly button and my knee, I cannot use proximal and distal to describe the difference or location between those two structures. So the only time you use proximal or distal to explain where one body structure is in relation to another is when both structures are on a limb. So what are some examples of structures that are on the upper limb? Your shoulder, your elbow, your wrist, your fingers. What about your lower limb? Your hip, your knee, your thigh, your ankle, your shin, your calf, your foot, your toes. So if the structures are not only both on a limb, but on the same limb, then I cannot use proximal or distal. So another example, if I was talking about my elbow and my knee, I still wouldn't use proximal or distal because they're on different limbs. So here we have in table 1.1 just more information about our directional terms. So superior is also known as cranial, inferior also known as caudal. We can see towards the head for superior, away from the head or towards the feet for our inferior. So an example of superior, the head is superior to the abdomen because the head's above the abdomen. That makes sense. Or how about for inferior? The navel is inferior to the chin. It makes sense that your belly button is below your chin. So in no way do I think, because we're going to do some examples, when you answer questions using directional terms, do I think, oh, they got that wrong, they don't even know where their chin is. That's not what I'm thinking. But these sentences can be confusing when you're trying to fill in that missing word, like superior or inferior. So I'll show you a trick. There's ventral, which also can be called anterior, dorsal, which also can be called posterior, and ventral is towards the front, dorsal is towards the back. Anterior and posterior are more commonly used in anatomy and physiology. Medial is towards the midline, like the mid-sagittal section. Lateral is away from the midline, like your shoulder is lateral compared to your nose. Your shoulders are closer to the outside compared to the midline, which is where your nose is located. And intermediate is also something that can be used, which is between a more medial and more lateral structure. Proximal and distal we'll come back to. Superficial is more external, deep is more internal. For example, your skin is superficial compared to skeletal muscles because they're under the skin. The lungs are deep to the skin because you can see the skin, so it's superficial, whereas the lungs are deep or more internal compared to the skin. For proximal and distal, if we look at our example, the elbow is proximal to the wrist. We know they used it correctly, not just because it's an example, but the elbow and wrist are both on the upper limb. The elbow is proximal to the wrist. If I read that another way, I would say that the elbow is closer to the point of attachment for the upper limb compared to the wrist. Because proximal means closer to the point of attachment compared to the other structure. And what's the point of attachment for the upper limb? That's going to be the shoulder. How about distal? The knee is distal to the thigh. I know that we're using distal correctly, again, not just because it's an example, but the knee and the thigh are both on the lower limb. If I read this example another way, I would read it, the knee is further away from the point of attachment for the lower limb than the thigh. Because distal means a structure that is further away from the point of attachment for a limb, or lower limb in this example, than the other structure. And this makes sense because my knee is further away from my hip than my thigh is. So my knee is a further distance away compared to my thigh. So let's try some examples. Here we have the nose is blank to the lips. The nose is above the lips, so if you chose superior, you're correct. Now, if you're not sure, the trick is to read this question backwards. And what I mean is, don't start with the nose and then compare it to the lips. Start with the lips. Go ahead and touch your lips. Now move to the first structure. Move to your nose. So if we start with the second structure and actually touch it, and then move our finger to the first structure, we're actually going to be moving in the direction that matches the term that we want to use. So if I touch my lips and then move my finger to my nose, the direction my finger moved was up or towards my head, further up towards my head, or further up my head, however you want to think about it. And the term that means to move up or to move further towards the head is superior. And that's my answer. The nose is superior to the lips. Also, see if you can answer this question down here. What are the proper regional terms for the nose and the lips? I'll give you a second. If you said nasal for nose, you'd be correct. If you said oral for lips, you would also be correct. Let's try another example. The knee is blank to the ankle. So go ahead and find those structures. Find your knee, find your ankle. And I'll give you a minute. Try to answer this just like reading the question forward. The knee is blank to the ankle. All right, if you said D, proximal, you would be correct because the knee is closer to the point attachment for the lower limb than the ankle. And this one is hard. The first thing I should have done is figure out, are both structures on a limb? Yes. Are both structures on the same limb? Yes. Therefore, my answer is proximal or distal, no matter what. And if you knew that, you wouldn't even actually have to figure it out because distal's not there as an answer choice. So the answer has to be proximal. But what if distal had been an answer choice? How can we double check our answer? Easy. Start with the second structure, touch it. So touch your ankle. Move towards the first structure, the knee. The direction you're moving is you're moving closer to the point of attachment for your lower limb. You're not moving further away, you're moving closer to the point of attachment. If you start with the second structure, then move to the first, it'll tell you what is the answer because you just match it with what you did. I moved closer to the point of attachment. The word that means that is proximal, and that's my answer. Go ahead and try what are the proper regional terms for the knee and ankle. I'll give you a minute. The knee is patella. You said that. You got it correct. And the ankle, that's tarsal. You said that. You got that correct. All right, one of our last topics is going to be body cavities and membranes. And body cavities are going to start broad and then get really more specific. And these body cavities are going to contain different organs or structures. And essentially, we're going to see that internal cavities of the body that we're about to talk about are closed to the environment. They're not open. There will be some things that are open, but these are closed internal body cavities. And they divide different degrees of protection to the organs that are within them. There's two sets of main, big, kind of broad categories for our cavities: the dorsal body cavity and the ventral body cavity. If you remember our terms, dorsal means towards the back, it's like posterior. Ventral means towards the front, like anterior. So the dorsal body cavity is behind the ventral body cavity. So in the dorsal body cavity, you have the cranial cavity and the vertebral cavity. In the ventral body cavity, you have the thoracic cavity and the abdominal pelvic cavity. Both the thoracic and the abdominal pelvic cavity also contain smaller cavities, or cavities within cavities. In your thoracic cavity are the cavities that contain your lungs, called the pleural cavities. In your thoracic cavity, there is also a cavity that contains your heart. That's called the pericardial cavity. Your abdominal pelvic cavity actually consists of two cavities, and the abdominal pelvic cavity is named after them. Abdominal for abdominal cavity, pelvic for pelvic cavity. Those are the two cavities that make up the abdominal pelvic cavity. So let's look at an image. So move forward. Here you can see that the dorsal body cavity in yellow contains the cranial cavity, which is where your brain sits. And then below that is the vertebral cavity, sometimes called the spinal cavity, but that's where your spinal cord sits. But the whole yellow structure is your dorsal body cavity. So the cranial cavity and vertebral cavity are within the dorsal body cavity. They're subdivisions. If we look at the ventral body cavity, we can see that it's separated into the thoracic cavity and the abdominal pelvic cavity. But in the thoracic cavity, you also have the pleural cavities, two because you have two lungs. You also have the pericardial cavity, you have one heart. And then you have an area above the heart called the superior mediastinum. That's an area where large blood vessels and your bronchi that go into your lungs are located. But actually that entire middle region is called the mediastinum, and just the part above the heart is the superior part of the mediastinum. If we look at the abdominal pelvic cavity, we can see it's actually separated into two cavities. The picture on the left shows us the pelvic cavity kind of sits like a bowl below the abdominal cavity. So spend some time looking at the body cavities. Be familiar with where things are situated. Make sure you know that the cranial and spinal or vertebral cavity are in the dorsal body cavity, and the ventral body cavity is going to be made up of the thoracic and abdominal pelvic cavity, and that the thoracic cavity contains two lungs. Therefore, it also contains two pleural cavities because the pleural cavities surround the lungs. And in the mediastinal region, we have the pericardial cavity and then the space above called the superior mediastinum. If you were asked, in what body cavity is the brain located? If you said dorsal body cavity, you are not wrong. Since the cranial cavity is within the dorsal body cavity and the brain sits within the cranial cavity, if you said dorsal body cavity, you'd be correct. The brain is in the dorsal body cavity. It's just not a very specific example. So that's an answer you can use on a test as long as you're not asked for the most specific answer. And the way I would ask for a specific answer, I would say, what body cavity contains only the brain? That would be the cranial cavity. What if I asked for a body cavity that contains the lungs? You could say pleural, but you could also say thoracic. You could even say ventral body cavity, because since the ventral body cavity contains the thoracic cavity, which contains the pleural cavities, all of those answers are correct. But if I said, what body cavity only contains the lungs, you would have to say pleural cavities. So just make sure you're reading the question well. So again, two pleural cavities. Pleural cavities surround each lung. That's why you have two, because you have two lungs. Mediastinum is going to contain the pericardial cavity in the area above where you have the esophagus, trachea, and other major blood vessels. That was the superior mediastinum. And then here you have pericardial cavity encloses the heart. So you have that information provided to you, and it's also in your textbook. Abdominal cavity, don't forget, it's made up of the abdominal and pelvic cavity. Be familiar with some of the basic organs you would find in these cavities, like the stomach, the small and large intestine, the spleen, the liver, and the abdominal cavity, and the urinary bladder, reproductive organs, and rectum in the pelvic cavity. So again, spend time looking at this image, be familiar with it, no general organs located where within these body cavities. And again, these are closed body cavities. Next, we're going to look at membranes, and the main membrane we're going to look at is the serosa. A serosa is a double-layered membrane, also called a serous membrane, and the two layers have names. There's one layer, which is the parietal layer, or serosa, and the visceral layer, or visceral serosa. The visceral serosa covers the organs in the cavity, so the visceral layer is going to be closest to body organs. Body viscera is another way to say body organs. So it makes sense that we're calling this layer the visceral serosa or layer. The parietal serosa lines the cavity walls and is going to be further away from the body organs, but not super far away. These layers, these double layers, are actually really close together. They're only separated by a slit-like cavity filled with serous fluid. And this serous fluid is going to be really lubricating. It's going to allow these layers to slide past each other, but also against organs. So the main goal of serosa or serous membranes is to reduce friction as organs move and slide past each other. That way we don't build up heat or cause inflammation. Here's an example of a serous membrane that is around the heart. If we wanted to be really specific, we would say this one particular serous membrane made up of two layers is called the pericardium, because that's the name for the serous membrane made up of two layers that surrounds just the heart. The part that is closest to the heart is the visceral pericardium. The part that's further away from the heart is the parietal pericardium. But these are not actually two separate layers. If you look at the image at the top of the screen, you can see that they're showing a balloon, and the balloon is going to be comparable to the serosas, whereas the air, the pocket, is going to be comparable to the serous cavity that would generally contain serous fluid. So imagine yourself punching a balloon. If your hand is the organ, the part of the balloon, if it doesn't pop, that surrounds your hand is the inner layer or the visceral layer of a serous membrane. The part of the balloon that doesn't touch your hand is the parietal layer or parietal serosa. And the air or space between the two layers is where the serous fluid or the slit-like cavity is located. Notice, however, that these two layers are not actually separate. They actually come together and fold in on themselves at the top. That's exactly how serous membranes are structured. So there are different serous membranes depending on what organ cavity or organ to which these serous membranes are associated. We just looked at the pericardium, which is associated with the heart. If you say pericardium, you're talking about both layers, unless you specify visceral or parietal. If you say pleurae, you're talking about the visceral and parietal layers of the lungs, which is a serous membrane that covers the lungs. And then peritoneum is a serous membrane that's actually very broad and covers the abdominal pelvic cavity organs. If you ever hear an organ being called retroperitoneal, that means that this organ sits not within the peritoneum, but actually behind the abdominal pelvic cavity and probably only touched on its front face by part of the peritoneum. A clinical or homeostatic imbalance that's associated with serous membranes is if they kind of stop doing their job. If for some reason there's not enough serous fluid or the layers themselves become inflamed, oftentimes this could be because of an infection, but there's plenty of other causes, and this would cause the smooth layers to become rough. They could stick together. This could be very painful. Examples are pleurisy and peritonitis. Peritonitis would occur in the abdominal pelvic cavity and pleurisy around the lungs. And this could prevent certain organs from expanding or moving as they need to because of the excess inflammation or fluid that could build up. Another thing we want to look at is abdominal pelvic quadrants. Quadrants are pretty simple, and they're used primarily by medical personnel as a really quick and easy way to find a large area where a wound or an injury is located. For example, if I said that the injury is located in the right upper, an area in the abdominal pelvic region where I am more likely to find the wound, but it's still a large area. Same thing goes for left upper quadrant, left lower quadrant, and right lower quadrant. So there's 4 quadrants, and notice that the right side is the patient's right, the left side is the patient's right, not your left or your right. So that's great for medical personnel to easily kind of quickly find something so they can treat an injury as quick as possible. But if we're not treating someone and we're studying anatomy, it's actually easier to divide the abdominal pelvic region into smaller segments. And so the 9 divisions of the abdominal pelvic regions that we're about to go through are used primarily by anatomists during study. I recommend just learning 6 because the left and right regions have the same name except for the word left or right. So if we start in the middle, the umbilical region is over your belly button. If we think of your stomach being located sort of right there, above the umbilical region is the epigastric region, which means above the stomach. Below the umbilical region is the hypogastric region, which means below the stomach. But this area is also known as the pubic region. So if you already learned that regional term, you may want to call that the pubic region. Next, we'll do the right side. Below the ribs is the hypochondriac region. The right hypochondriac region is actually below where the ribs would end on the right side. The right lumbar region is on the front, but it's right about where the lumbar region would be next to your vertebrae. And then the right iliac region or inguinal region is located near the inguinal body region, but also near a vessel called the iliac. So be familiar with these abdominal pelvic regions and the basic structures you would find in each. For example, most of the stomach is located in the epigastric region. Most of the small intestine is located in the umbilical region, but parts of it can be found in the left lumbar region, right lumbar region, and even the hypogastric region. If you had a question on an exam, you would have to pretty much be finding structures that are mostly located or completely located in regions. For example, the urinary bladder is located only in the pubic or hypogastric region. And still, there's other body cavities. In addition to the 2 main body cavities, you have in the body the oral and digestive cavities, nasal cavity, orbital cavities, middle ear cavities, and eventually we'll get to joints and look at synovial cavities. And some of these cavities are actually open to the human body. So they're open body cavities, whereas the ones we looked at previously were closed body cavities. So pretty much stay tuned for these body cavities. Some will be handled in anatomy and physiology too. And that's it for the first chapter of Anatomy and Physiology 1. So make sure to review both parts and look for chapter 2, which is coming up.